Most people don't realize it, but combining cloves with the wrong foods or medications can trigger life-threatening reactions. Today, you'll discover 9 dangerous combinations that every adult must avoid to stay safe. Welcome to the FreshFuel Guide. Most people think of cloves as a harmless spice, but for adults, especially those taking medications, the wrong combination can turn this tiny flower bud into a serious health threat. What makes this dangerous is how silently these reactions occur. Your blood can thin without warning. Medication levels can spike unexpectedly, and blood sugar can crash long before you realize something is wrong. Scientific evidence from journals such as BMC Complementary Medicine, Prostaglandins and Leukotrienes, and Clinical Pharmacology confirms that compounds in cloves can alter digestion, disrupt liver enzymes, and intensify drug effects well beyond safe levels. In this video, you and Emma will uncover 9 specific combinations that doctors rarely warn about, but understanding them could help you prevent emergencies and protect your long-term health. Number 1. Blood-thinning medications. How cloves intensify bleeding risks. Warfarin, clopidogrel, aspirin. Many people assume a small amount of spice can't interfere with medication. But cloves are a dangerous exception. A documented case showed a patient stable on warfarin after a heart attack, who suddenly experienced an INR jump from 2.5 to a life-threatening 7.8 after just a few days of consuming clove-rich holiday dishes. The culprit is eugenol, making up 90% of clove oil, which inhibits platelet aggregation and blocks thromboxane formation. Research in prostaglandins, leukotrienes and medicine shows eugenol can increase bleeding risk by 300 to 400% when combined with warfarin. Clopidogrel, or aspirin, with a bloodstream half-life of 14 to 18 hours. Its effects stack daily, raising the risk of internal bleeding and brain hemorrhage. Next is a hidden interaction affecting more than 75% of common medications. Number 2. Liver-Metabolized Medications. How cloves disrupt drug clearance. Few people realize that cloves can interfere with the liver's ability to process medications. But a documented case at Johns Hopkins made this danger clear. A patient taking cholesterol and anxiety medications developed unexpected spikes in drug levels after starting daily clove extract. The reason is eugenol, the primary compound in cloves, which strongly inhibits key cytochrome P450 enzymes, especially 2-cypriot-pounds C9, CYP2D6, and CYP3A4. These enzymes metabolize more than 75% of prescription drugs. When inhibited, medications are not cleared but instead accumulate, increasing the risk of liver toxicity, severe muscle damage with statins, or dangerous rhythm changes with certain antidepressants. And the next interaction becomes even more alarming for adults managing diabetes. Number 3. Diabetes medications. When clove tea triggers dangerous hypoglycemia. Many people believe clove tea helps control blood sugar, but for individuals taking metformin or insulin, this combination can lead to severe hypoglycemia. A documented case described a well-controlled type 2 diabetic who experienced 2 emergency episodes after drinking clove tea twice daily. Research published in BMC Complementary Medicine and Therapies shows that clove extract can lower blood glucose by 21 to 27% by slowing intestinal glucose absorption, reducing liver glucose production, and increasing muscle glucose uptake. When combined with medications that target the same pathways, blood sugar can drop rapidly, causing confusion, trembling, rapid heartbeat, or even loss of consciousness. And the next interaction becomes even more dangerous when cloves are mixed with alcoholic beverages. Number 4. Alcohol and alcoholic drinks. When cloves intensify acetaldehyde toxicity. Many people enjoy mulled wine or spiced cocktails without realizing how dangerous the combination of alcohol and cloves can be. Clinical reports describe cases of flushing, rapid heartbeat, and sudden drops in blood pressure after consuming alcoholic beverages infused with cloves. The reason is eugenol, which inhibits aldehyde dehydrogenase, the enzyme responsible for breaking down acetaldehyde, the toxic byproduct of alcohol metabolism. When this enzyme is blocked, acetaldehyde builds up in the bloodstream, increasing toxicity by 40 to 60% and triggering nausea, headaches, and severe intolerance reactions in sensitive individuals. Holiday drinks like mulled wine, spiced rum punches, or clove-studded hot toddies can amplify this effect. Number 5. Stomach medications, PPIs and antacids. How cloves alter drug absorption. Many people take omeprazole, pantoprazole, or antacids daily for acid reflux or stomach discomfort. Yet few realize that cloves can quietly interfere with how these medications work. Polyphenols in cloves can influence stomach pH and slow gastric emptying, two factors that determine whether these drugs are adequately absorbed. Some studies also show that eugenol may affect digestive enzymes, making medication processing less predictable, especially for people who rely on long-term therapy. Number 6. Iron and iron-rich foods. When clove tannins block up to 90% of iron absorption. Many people take iron supplements or eat iron-rich foods without realizing that drinking clove tea or eating clove-spiced dishes can quietly cancel out their efforts. A clinical study on anemia patients found that several individuals failed to improve simply because they unknowingly consumed cloves with their iron-rich meals. Tannins in cloves, responsible for their astringent taste, bind directly to iron in the digestive tract, forming insoluble complexes the body cannot absorb. Research published in Current Developments in Nutrition shows tannins can reduce iron absorption by 60 to 90%, especially non-heme iron from vegetables, legumes, cereals, and supplements. Even drinking clove tea close to an iron-rich meal can dramatically reduce iron intake. Next is an interaction that directly disrupts your gut microbiome and digestive medications. Number 7. High-fiber foods and digestive medications. When cloves disrupt your gut microbiome. Many people increase their fiber intake to improve digestion, yet experience bloating, gas, and irregular bowel movements when their meals contain cloves. A clinical digestive health study found that eugenol in cloves has strong antimicrobial properties, capable of killing not only harmful bacteria but also beneficial gut microbes. Research published in the Journal of Applied Microbiology shows that eugenol can interfere with fiber fermentation, a crucial process that produces beneficial short-chain fatty acids. When fiber cannot ferment properly, it accumulates and causes discomfort. This disruption also reduces the effectiveness of digestive enzymes, gut-supporting medications, and probiotic supplements, making individuals with digestive conditions more vulnerable to symptoms. Number 8. Antihistamine medications. When cloves increase sedation and alter allergy relief. Few people realize that cloves can interact with antihistamine medications, which are widely used during allergy seasons. Studies published in Phytotherapy Research and Food and Chemical Toxicology show that eugenol in cloves can modulate H1 receptors and mast cells, both of which are central to allergic responses. When combined with loratadine, cetirizine, or diphenhydramine, eugenol may amplify sedative effects, causing increased drowsiness, reduced alertness, and slower reaction times. At higher intakes, this combination can also alter the effectiveness of allergy relief, leading to fatigue, dry mouth, and decreased mental clarity throughout the day. Number 9. Calcium and dairy products. When cloves reduce the body's ability to use calcium. Many people drink milk or take calcium supplements daily to support bone health. Yet few realize that consuming clove-spiced foods or beverages can quietly reduce the effectiveness of calcium. Digestive health research shows that polyphenols in cloves can bind to minerals, slowing absorption and making it harder for the body to utilize calcium, even when blood calcium levels appear normal. Certain compounds in cloves also influence the gut microbiome, an essential factor in calcium metabolism and bone mineralization. When the balance of beneficial bacteria is disrupted, the body's ability to use calcium decreases, especially in individuals at risk of osteoporosis or those relying on calcium supplements. If you find this information helpful, make sure to subscribe so you don't miss other essential health insights. And up next is the conclusion that shows you exactly how to protect yourself from all 9 of these dangerous interactions. Although cloves are among the most antioxidant-rich spices in the world, this journey has shown that their biological power can become a double-edged sword when combined incorrectly. The increased bleeding risk, drug accumulation in the liver, sudden drops in blood sugar, impaired absorption of iron and calcium, and disruptions to the gut microbiome all stem from mechanisms confirmed by scientific research, primarily the potent actions of eugenol. The key is not to eliminate cloves, but to use them with intention. A practical rule you can apply immediately is to separate clove-containing foods or drinks from your medications by at least 2 to 4 hours. Avoid highly concentrated extracts, and pay close attention to warning signs such as dizziness, unexpected bruising, or changes in blood sugar. Have you ever noticed unusual reactions after eating dishes containing cloves? Please share your experience so others can learn from it as well. Thank you for watching, and I'll see you in the following video.